Hey YouTube family, welcome back to the channel. My name is Khoa. I am currently a critical care nurse. I work in the medical ICU and surgical ICU. Today I wanted to put together a little video about select all apply questions, SATA. These specifically for like the next generation NCLEX questions. I wanted to do this video because I read some YouTube comments on my channel and as well as received some messages from friends who are currently in nursing school, that SATA is one of the biggest concern that they have when it comes to studying the NCLEX. And in all honesty, it was mine as well. I took the NCLEX last year right after graduations, and it was hard. Yeah, it was one of the hardest part when it comes to the NCLEX. My NCLEX was not the next generations. However, there are similarities. These questions that I'm going to practice with you guys today, these are next generation questions. These are practice questions that I hope will help you guys strengthening your skill when it comes to selecting the choices for SATA questions. So with that being said, let's just go ahead and get started. And thank you again for watching my video. Alright, you guys, so I'm trying this new features that I've never used before. So I basically can't even see myself right now, okay? There's just a PowerPoint in front of my face, so if I'm obstructing the words, I'm sorry. I will attach a copy of this PowerPoint below in the description box, so so you guys can have the full PowerPoint. But like I mentioned, these are next generation NCLEX SATA practice questions, and I hope this will help you guys in process of learning for your NCLEX. All right. Question number 1: a nurse in a medical unit is caring for a client with heart failure. The client suddenly developed extreme dyspnea, tachycardia, and lung crackles. All right. Ding, ding, ding. Heart failure, dyspnea, tachycardia, lung crackles. Typical sign symptom of pulmonary edema, right? Okay. And the nurse suspects pulmonary edema. Yeah. The nurse immediately notifies the provider and expect which interventions to be prescribed. Select or apply. All right. So when we're reading these questions, heart failure, and you guys reading the sign symptom, dyspnea, tachycardia, lung crackles. These are sign symptom of left side heart failure, correct? Because when the left side of the heart fail, it's back up to the lungs, and this is causes pulmonary edema in the lungs. All right, so let's see our choices. Administer oxygen, inserting a Foley catheter, administering furosemide Lasix, administering morphine sulfate intravenously, transporting the client to the coronary care unit, and placing the client in a low flower sideline position. All right, guys, tell me which answers are you guys going to pick? Okay. You guys can pause, but I'm gonna go ahead and with my answer right now. Okay, so before I look at the answer, I'm thinking the answer choices that I'm going to pick is administering oxygen. First of all, why? Administering oxygen is because these patients are in dyspnea, difficulty breathing, tachycardia. These patients need oxygen, right? Next to inserting a Foley catheter, I say yes, but usually inserting a Foley catheter is to accurately measure the urine output, right? Usually we put a Foley catheter in the patients usually who have who take Lasix, so we know exactly how much fluid urine output is being produced. So, and this patient is in pulmonary edema, which means that the alveoli, the lungs, are exert with fluid because of all like the blood backed up from the left ventricle. So I'm gonna pick 1, 2, and then 3, administering furosemide Lasix. I picked this as well because furosemide Lasix is a diuretic medications, and obviously if fluid overload, pulmonary edema, fluid overload in the lungs, we want to diurese the patient, get the fluid out, make them pee out. So that's why we give them oxygen, put in a Foley, and give them Lasix, right? 4, administer morphine sulfate intravenously. I think yes. The reason why we give morphine is because of 2 reasons. These patients are in dyspnea. Giving morphine will causes the venous to dilate. So the vein will dilate, causing vein dilation. And when the vein dilate, there's less preload, meaning less volume is going to the right ventricle. And if we have less blood going to the right ventricle, that means that less blood is going to the lung, right? Because right ventricle, right atrium, right ventricle, and to the lungs. So if we have less blood going to the lung, we will have the patient will breathe easier. So that will fix dyspnea, and also morphine is calm the patient down, make them free of pain. So it will help with the tachycardia as well. All right. So 1, 2, 3, 4. I picked them all so far. 5, transporting the client to the coronary care unit. This is not really necessary. You want to treat the patient right there and then. You don't want to delay care and wait for the patient to be transported, because it's life-threatening, right? The patient is obviously difficulty breathing right now. 6, placing the client in low flower side lying position. No, this is a no, no, no. If the patient already struggling to breathe, you don't want to laying them down in a low flower. You want to sit them up, right? And side lying, no. Usually you do side lying is when you put in an enema. Okay. All right. Let's see the answer. Okay. So answer choices. Correct answer are 1, 2, 3, and 4. So let's read their rationale. Is it matched with mine? Okay. Pulmonary edema is a life-threatening event that can result from severe heart failure. In pulmonary edema, the left ventricle fails to eject sufficient blood. Okay. Because of heart failure, left ventricle fails to eject sufficient blood, and pressure increase in the lungs because of the accumulated blood. Oxygen is always prescribed, and the client is placed in high flower position to ease the work of breathing. Furosemide, a rapid-acting diuretic, will eliminate accumulated fluid. Let me go off the frame so you can see. A Foley catheter is inserted to accurately measure output. Intravenously administer morphine sulfate reduces venous return preload, decrease anxiety, reduces work of breathing. Transporting the client to the coronary care unit is not a priority intervention. So in fact, this may not be necessary at all if the client response to the treatment is successful. All right, next question. Oh, this is question number 2. Okay, the nurse is preparing a teaching plan for a client who is undergo cataract extraction, okay, with intraocular implant. Which home care measures will the nurse include in the plan? Select or apply. All right, number 1, to avoid activities that require bending over. Okay, that sounds about right to me, because when you bend over, you increases the pressure in your eyes, right? And especially who are going to under surgery in the eyes, you want to teach them avoid these activity when they're home. So I pick 1. To contact the surgeon if eye scratchiness occur. I mean, obviously right after the surgery, there will be discomfort, right? So I wouldn't teach them to contact the surgeon if eye scratchiness occur. Number 3, to place an eye shield on the surgical eye at bedtime. What do you guys think? I think yes. This is pretty common. We all seen people having eye shield over eye after surgery, just obviously to prevent straining on the eye, opening the eye accidentally, or also preventing any bright lights to the eyes, right? So and also at bedtime. So yeah, I agree with that. So I pick 1 and 3. 4, that episode of sudden severe pain in the eye is expected. Okay, make sure you read the whole sentence. So if we only read that episode of sudden severe pain, we already picked it because we think, okay, this is important, sudden severe pain. But it's actually not the case. Obviously, we want the patient to report if they have a sudden severe pain in their eyes, but that is not expected. Sudden severe pain is not expected. So we don't teach that. We don't teach that it is expected. So that's wrong, right? So 1 and 3 is correct so far. 5, to contact the surgeon if a decrease in visual acuity occurs. This is hard. I would say yes. I would say to pick this because it is not a normal sign. Okay. And 6, to take acetaminophen Tylenol for minor eye discomfort. Yeah, you can take Tylenol if you feel discomfort. It's reasonable. So 1, 3, 5, and 6. Yay, I got it correctly. So answer 1, 3, 5, and 6 are correct. So rationales. After eye surgery, some scratchiness and mild eye discomfort may occur in the operative eye and is usually relieved by mild analgesics. If the pain becomes severe, the client should notify the surgeon because this may indicate hemorrhage, infections, or increased intraocular pressures. The nurse would also instruct the client to notify the surgeon of purulent drainage, increased redness, or any decrease in visual acuity. The client is instructed to place an eye shield over the operative eye at bedtime to protect the eye from injury during sleep and to avoid activity that increase intraocular pressure, such as bending over. All right, next question. Question number 3. A nurse is caring for an infant with a diagnosis of tetralogy Fallot. The infant suddenly becomes cyanotic and the oxygen saturation reading drops to 60%. Choose the interventions that the nurse should perform. Select or apply. 1. Call code blue. 2. Notify the provider. 3. Place the infant in a prone position. 4. Prepare to administer morphine sulfate. 5. Prepare to administer intravenous fluid. 6. Prepare to administer 100% oxygen by face mask. Alright, so I have a video talking about the tetralogy of Fallot and stuff. If you guys want to watch, I'll link the link somewhere. But anyway, back to this question. I give you guys a moment. Okay, you guys can pause and choose the answer choices, but let's do this together. Number 1, call the code blue. I mean, the oxygen dropped to 60%. That's bad. That's really bad. And they're becoming cyanotic. That's really, really bad. However, there's still I assume there's still a pulse, and breathing is not ceased yet. The breathing is still there. It's just low. The oxygen is just 60%. So I wouldn't call code blue. So this, I will not choose number 1. Number 2, notify the provider. Yes, this is critical because it can turn into a code blue potentially, but it's not a code blue yet, so do not call a code blue. But number 2, notify the provider is appropriate, so I'm choosing number 2. Place the infant in a prone position. No. Obviously, they are in respiratory distress. You don't want to prone them. They won't be able to breathe anymore. Usually for tetralogy of Fallot, the key thing to remember is knee to chest position. It helps with the child with breathing. Okay. Number 4, prepare. So we don't choose number 3. Number 4, prepare to administer morphine sulfate. Yes. Remember we talked about earlier, morphine, it dilate the vein, therefore decrease the preload, which is the volume that go into the right atrium and right ventricle, and we have less blood going into the right ventricle and right atrium, which is called preload. That means that there will be less blood going to the lungs, so there will be more space. And it's just easier for the child to breathe, and also it calms the child down, right? Number 5, prepare to administer. So I would choose number 4. So I would so far is number 2 and number 4. Prepare to administer intravenous fluid. Yes, number 5, I would choose it too. You always start with some intravenous fluid, because when the tetralogy are Fallot and they become a cyanotic, they are in a cyanotic spell, and usually you need intravenous fluid to improve the blood pressure. 6, prepare to administer 100% oxygen by face mask. Absolutely. The oxygen drops to 60%, the SAT post-op drop to 60%, you want to give them 100% oxygen by face mask. All right, so let's see if it's correct. Yes, so 2, 4, 5, and 6. So let's read their rationale. The child who is cyanotic with oxygen saturation dropping 60% is having a hypercyanotic episode. Hypercyanotic episodes often occur among infants with tetralogy of Fallot, and they may occur among infants whose heart defects include the obstruction of pulmonary blood flow and communication between the ventricles. If a hypercyanotic episode occurs, the infant is placed in a knee-chest position immediately. The register is notified, who will then contact the healthcare provider. The knee-to-chest position improves systemic arterial oxygen saturation by decreasing venous return so that smaller amount of highly saturated blood reach the heart. Toddler and children squat to get into this position and relieve chronic hypoxemia. Cool. There's no reason to call code blue unless respiration ceases. Additional intervention include administer 100% oxygen, morphine sulfate, intravenous fluid as prescribed. All right, next question. Question number 4. When teaching a client about side effects of nitroglycerin tablets, which of the following should be included? 1, headache. 2, dizziness. 3, confusions. 4, flushing. 5, sweating. 6, hypertension. I gave you guys a moment. Okay, you guys can pause and, Anyway, let's go through the answer choices together. Number 1, well, before that, nitroglycerin, what is it? Nitroglycerin is a vasodilator medication, right? We usually give nitroglycerin for what? We give nitroglycerin for patients who are having angina, right? So the medication is vasodilating. That means that will they cause headache? Yes. Number 1 is a side effect of nitroglycerin, because when the vasodilated, when the vein is dilated, it causes flushing. More blood is going up to the brain, so it causes flushing, and it can cause headache. More perfusion to the brain. Dizziness could be, yes, because it's vasodilated, so the pressures of the blood squeezing through the veins will be decreased. So low blood pressure can be caused by nitroglycerin because it's a vasodilator, so it can cause dizziness. So 1 and 2. Confusions. I'm not sure. Let's put it there, but don't disregard it yet. 4, flushing. So yes, because if it's vasodilate, more blood going to the surface area and causes flushing. Sweating, no. Hypertension, no. It's a vasodilator, so it won't cause hypertension. Will it cause confusions? I don't think so. I may be wrong, but I don't think so. Okay, so definitely headache, definitely dizziness, definitely flushing. So I'm gonna go with that. 1, 2, and 4. Yay, I got it right. Headache, dizziness, and flushing. I confusion is wrong for sure. Yeah, I don't know why I was debating between it, but anyway, it won't cause confusion. Okay. Rational side effects of nitroglycerin include headache, flushing, hypotension, and dizziness. All are related to vasodilation action of the medications. Next, question number 5. Following a lumbar puncture, the nurse reviews the result of the client's cerebrospinal fluid, CSF, which finding indicate possible bacterial meningitis. So I think that for NCLEX, they're going to ask you to differentiate bacterial meningitis and viral meningitis. So important to know which one is which. But honestly, just learn one. which is bacterial meningitis, because it's more common. And if you know one, you don't need to know the other one. Yeah, right? Because it's just opposite. All right, so bacterial meningitis. This question, honestly, if you know, you know. If you don't know, you don't know. But we can guess, right? When we talk about bacteria infections, we always think about purulent drainage, cloudiness. So number one, turbid CSF appearance. What is turbid? Turbid is cloudiness. So yes, because it's bacterial meningitis, bacterial. So turbid CSF, right? Increased neutrophils. Yes, neutrophils. Why we pick neutrophil? Because they targeting bacteria, they killing bacteria. It's an infections, right? So 1 and 2 is correct. Scan red blood cells? No, usually CSF are clean and clean, not clean, but like it's clear. So it's not, there's no red blood cells in it, unless there's some issues. But bacterial meningitis wouldn't have red blood cell in the CSF. 4, elevated glucose. I don't know, or maybe yes, I don't know. But this is because I already know it. Bacterial meningitis have low glucose in the CSF compared to the high glucose, because of the neutrophil uses the glucose to kill the bacteria, if that makes sense. So the glucose is low. In viral bacterial meningitis, there's not an increase or high in neutrophils, because therefore there's high glucose level in the CSF. Clear CSF appearance is a no-no, because that is viral meningitis. All right, so will be 1, 2, and 6. Yay. So rationale: normal CSF is clear. Turbid or cloudy appearance is related to white blood counts in the CSF. An elevated neutrophil count indicated infections. The CSF glucose level is low because neutrophil required to fight the infections. Oh, cool. All right, question number 6. The chart nurse on a pediatric unit is making shift assignments. Which of the following tasks can be appropriately assigned to an LPN, LVN, and select or apply? I also have a video talking specifically LPN and LVN, and the role, the scope of practice of LVN versus RN. It will be something that will be asked on the NCLEX exam as well, so make sure you know it. All right, answer: administer a medication by IV push, provide discharge teaching for a simple post-op surgery, contacting the healthcare provider with abnormal lab result, give gastronomy to feeding. 5, insert an indwelling urinary catheter. And 6, insert a child hearing aid. All right, you guys, I'll give you guys a few moments. Okay, so let's talk about it. Number 1, administering a medication by IV push. No. LVN only give oral medication, unless it's specified by like the facility or they receive special training. However, according to NCLEX, we only LVN only give oral medication. Okay, IV push are only RN. So number 1 is no. Number 2, provide discharge teaching for a simple post-op surgery. It doesn't matter if it's simple or hard. LVN cannot provide teaching. LVN can only reinforce what the nurse have taught. Okay, so please remember that. Number 3, contacting the healthcare provider with abnormal lab results. No, the LVN cannot interpret what's normal or what abnormal. I mean, obviously they have the knowledge, they know it, but in their scope of practice, they are not the person who will contacting the healthcare provider. The RN will. Number 4, give gastronomy to feedings. Yes, so this is what the LVN can do for sure. They can give 2 feedings through the NG and the gastronomy tube. First of all, it's not a sterile procedure. It's you only need gloves for it. You only need to hook up the 2 feet, go through the kangaroo pump, and then hook it and flush and hook it into the PEG tube, the gastronomy tube. All right, number 5, insert an indwelling urinary catheter. Yes, LVN can do this, okay? 6, insert a child hearing aid. Yes, obviously, it's just a hearing aid. So answer choice from me is number 4, 5, and 6. Yay! All right, so let's read their rationale to see if it's match mine. The LPN-LVN scope of practice includes administering oral medications as well as tasks involve feeding and activities of daily living. Some facility may allow for IV push administration, but special training is necessary. So yeah, you guys, for NCLEX period, for NCLEX purpose, just know that LVN only give oral medication. Contacting the ACP healthcare provider with lab result and providing discharge instruction require assessment and higher level skill, which are beyond the scope of practice for LVN. Okay. Question 7. A 20-year-old college student with a known diagnosis of type 1 diabetes is brought to the ED by his roommate. The roommate states that the client seems sick and has been acting strange. Which sign and symptom indicate possible ketoacidosis? So what is ketoacidosis? Ketoacidosis is a state of acidosis caused usually by the patient who are in diabetic ketoacidosis, DKA, who have type 1 diabetes, right? So with that being said, yeah, let's read the answer choices first. Lack of thirst, anuria, questionable breathing, abdominal pain, confusion, fruity smell, lean breath. All right, give you guys a few moments to pick the answer choices. Okay, so all right, so number 1, lack of, okay, before we go through the answer choices, let's talk about DKA. So obviously we know DKA is in type 1 diabetes. The question even mentioned that, diagnosed with type 1 diabetes. So, and they talk about ketoacidosis. So we obviously know that this patient, they asking about DKA. So when patient is in DKA, their blood sugar is obviously very, very high, right? So if we have a high blood sugar content in the blood, in the vessel, the blood flow will be obstructed, right? The blood cell will be obstructed and the flow will be obstructed. So there will be like a very sluggish blood flow, right? And in DKA, the patient does not metabolize the glucose. The insulin does not work. There's no insulin actually. There's no insulin, so the blood sugar stay in the blood, and the cell is starving for blood sugar. So what does the body do? It cannot use the sugar because there's no insulin. So what does it do? It metabolizes fat to create energy for the cells. And when it's metabolized, the fat, there's a byproduct, which is the ketone. And when we have ketone byproduct, it causes, it's an acidic agent, so it causes acidosis in the patients and lead to DKA, diabetic ketoacidosis. So what are the signs and symptoms? Polyuria, polydipsia, polyuria, polydipsia, and one more I don't remember, but it's just basically a severe thirst and polyuria pee a lot. So number 1, lack of thirst. So obviously that is wrong, right? These patients who are in DKA, they are dry like a desert. They want to drink a lot of water. Their blood sugar content is so high. They are so concentrated. They're so thirsty. So number 1 is wrong, right? Number 2, anuria. That's wrong as well. These patients pee out so much. They're in DKA. They pee out so much. So polyuria. So number 1 and 2 are not signs symptom of DKA. Questionable breathing. Yes. These questionable breathing are hallmark signs of DKA. Patients who are in DKA, they have questionable breathing. Questionable breathing is rapid and shallow. No, rapid and deep breathing. They breathe deeply but very rapidly, so it's called Kushmo breathing. Abdominal pain, yes. The reason is because, like I mentioned earlier, when the blood sugar is so high, the blood flow is sluggish and it obstructed the blood flow to the gut, so it can cause abdominal pain. Confusion, yes. Again, when the blood sugar is so high, less blood is flow continuously to the brain, it can cause confusion. Fruity smelling breath, that's like a givey. We obviously know that's for DKA, fruity smelling breath, right? It's a hallmark sign. So again, answer choices are 3, 4, 5, and 6. Perfect. So let's read the rationales. DKA is a serious condition that requires immediate interventions. Common signs and symptoms include Kushmo breathing, characteristic hyperventilations, extreme thirst, frequent urination, nausea and vomiting, fruity smelling breath, confusion and foggy thinking, fatigue and lethargy, abdominal pain, and tachycardia because they are hypovolemic. All right, question number 8. A client with a diagnosis of schizophrenia is experiencing active hallucination. Choose all the appropriate nursing actions. I'll give you guys a moment. Oh, let me read the question answer choices first. Administer medication as ordered. Use therapeutic touch to reassure the client as if any voices are telling them to hurt themselves. Agree with the client impressions. Distract the client with a movie or a game. Explain others are seeing the same thing. All right, you guys. Okay. So let's go through administer medication as ordered. Yes, that's always going to be correct. You always want to administer medication as ordered. Unless there's anything wrong with the order and the question specifies it, okay? Or unless you clearly see it's the wrong thing. For example, the patient blood pressure is low and there's an order to give metoprolol, you wouldn't give it, right? Because it's a blood pressure, blood hypertension medications. Next, so we want to give administer as orders. So number 1 is correct in this case. Use therapeutic touch to reassure the client. You do not want to touch someone who are having or experiencing active hallucination because they might interpret it differently. They might interpret it as a threat. So number 2 is no. Number 3, as if any voices are telling them to hurt themselves. That is correct. We always want to know if they are hurting themselves or planning to hurt themselves or others. Number 4, agree with the client impressions. No, you don't want to agree with them. You want to state the fact, the truth, and then distract the client with a movie or a game. No, I don't think so either. So I think the only, and number 6, explain others are seeing the same thing is a no as well, because no, how do you know the others are seeing the same thing? And that's not truthful. So number 1, I'm choosing number 1, and then I'm choosing number 3. So 1 and 3 is my final answers. Yay. So rationales. No matter the client or the situation, protecting their safety is the nurse's main concern. Administer prescribed medication is essential. Determine if the client intends to harm himself or others is important. Hallucinating clients should not be touched or placed in an environment with increased stimulations. Telling the client that others are experiencing the same thing or agreeing with him does not help the client return to reality. Right, next questions. Which findings are typical of end-stage renal disease? Cool. 1. Increased potassium level in the blood. 2. Increased albumin levels. 3. Decreased creatinine clearance. 4. Metabolic acidosis. 5. Respiratory alkalosis. 6. Iron deficiency anemia. All right, I give you guys a moment. You can pause and take and do it, okay? I'm gonna go over it right now. So number 1, increased potassium level in the blood. Is this a typical finding of end-stage renal disease? Yes, this is correct. Why? The reason why is if we have an increased potassium level in the blood, this means that the kidney is not working as good, because healthy kidney excrete potassium, right? It regulate potassium level and maintain in a normal range. So a damaged kidney someone who have a damaged kidney who need dialysis will usually have a very high potassium level. Increased albumin levels, that is a no. End-stage renal disease will cause albuminuria. What albuminuria means is there's albumin in the blood, in the urine. So usually healthy kidney will keep the albumin in the blood because kidney does not filter protein out. So if we see protein in the urine, that means that the protein is passed from the blood to the urine. Albumin is a protein. So number 2 is not a typical. It does not cause an increase in albumin level. Number 3, decreased creatinine clearance. Yes, right. So we will see an elevation of the creatinine numbers in the lab because of the decreased creatinine clearance in end-stage renal disease. The kidney is unable to clear creatinine, which is an indication of the kidney function, right? So it will have elevated creatinine because there's a decrease in their clearance. 4, metabolic acidosis. Yes. So number 3 and 4, it causes metabolic acidosis in end-stage renal disease. Why? Because kidneys, it produces a buffer called bicarbonate, HCl3. So if we have a damaged kidney, there's not enough bicarbonate is being produced or regulate. So that's why it leads to metabolic acidosis, because bicarbonate is a buffer. It's an alkalytic agent. Number 5, respiratory alkalosis. No, there's nothing related to the kidney. 6, iron deficiency anemia. Yes. So kidney, or in fact the adrenal gland, which is right above the kidney, it produces a hormone called erythropoietin. Erythropoietin will be the hormone that stimulate the bone marrow to produce red blood cells. And if the kidney is damaged, erythropoietin, which is the hormone, will be decreased. So we will be anemic. There's not enough red blood cell will be produced because of kidney disease. Okay. So my final answer choice are number 1, number 3, and number 6. 1, 3, 4, and 6. 1, 3, 4, and 6. Yes. Oh, number 2, albuminuria. I forget to fix it, I think. So this number 2 is wrong, but if it was albuminuria, it will be correct. All right. Sorry about that. But albuminuria, which is albumin in the urine, is a sign of CKD. However, increased albumin levels is not. Okay, end-stage renal disease result in the following: decreased creatinine clearance secondary to decreased glomerular filtration rate (GFR), serum creatinine (MBUN) level rise. Okay, metabolic result when kidneys are unable to excrete ammonia and reabsorb sodium bicarbonate. When kidneys are no longer able to produce erythropoietin, which stimulate the bone marrow to produce more red blood cells, the result is iron deficiency anemia. Healthy kidney regulate and excrete potassium. Patient with AKI or CKD will have problem excreting potassium, hence elevating blood potassium level. Albuminuria is albumin in the urine. Albumin is a protein found in the blood. Healthy kidney does not let albumin pass from blood to urine. The other options are incorrect. All right. Last questions. A client with a T4 spinal cord injury is at risk for autonomic dysreflexia. Which of the following are signs and symptoms of this clinical disorder? This come up a lot in NCLEX. They like to ask autonomic dysreflexia, okay? And remember, T4 above T6 spinal cord injury usually result in autonomic dysreflexia. Okay, remember that. All right, number 1, question answer, tachycardia. Number 2, blurred vision. Number 3, extreme hypertension. Number 4, severe headache. Number 5, pale skin. Number 6, diarrhea. All right, what are your choices? I'm gonna pause. Okay, so number 1, tachycardia. Yes, this is a sign of autonomic dysreflexia. Number 2, blurred vision. I'm not sure. I don't think so. Number 3, extreme hypertension. Yes, these are hallmark sign of autonomic dysreflexia. This autonomic dysreflexia usually caused by a severe, not severe, but like caused by a bladder distension, or it can cause by a fecal impactions, or very tight closed jeans can also cause autonomic dysreflexia as well. It is because when the patient have a T6 injury and above, anything below the T6 injury, for example, the extended bladder, it causes a symptomatic nervous system response. However, the communication is broke down at the T6 injury level of the spinal cord. So there's a different regulation of nervous system above the injury and below the injury. Therefore, it leads to these sign and symptom. And autonomic dysreflexia is a severe, lethal, life-threatening situation. All right. So these patients will have extreme hypertension. They also have severe headache. Okay, so tachycardia, extreme hypertension, severe headache. And I think that's it. No pale skin, no diarrhea. So 1, 3, and 4. My bad. They don't have tachycardia. They only have blurred vision, extreme hypertension, and severe headache. So actually, they don't have tachycardia. I'm so sorry about it. They actually have bradycardia, not tachycardia. Bradycardia is a hallmark sign of autonomic dysreflexia. So bradycardia, extreme hypertension, and severe headache. All right? So rationale, autonomic dysreflexia is an emergency situation in which there is a sudden onset of extreme hypertension, bradycardia, pounding headache, blurry vision, flushed skin, and nasal stuffiness, sweating above the area of injury, and goosebump below the area of injury. Okay, sweating above and goosebump below. It is more common in people with spinal cord injury that involve thoracic nerves of the spine or above. It is often triggered by a full bladder or fecal impactions. It can be life-threatening and requires immediate interventions. All right, so see, clearly I'm not meant to be a neuro ICU nurse. But yeah, let me turn it on again. But yeah, you guys, thank you so much for watching the video, and I'll go back to the first place. Thank you so much for watching the video, and I hope you guys enjoyed it. I hope this will help with you all in studying for NEXTGEN NCLEX. If you're studying for the NCLEX, check out my other videos about my NCLEX experience, and also different parts of the NCLEX need to know contents. I'll link somewhere right here. With that being said, thank you so much and goodbye.